All right. So we are live. Welcome, everyone. Susanna Craig with Pandia Health here. Happy to have Dr. Sophia Yen, our wonderful co-founder and Chief Medical Officer at Pandia Health. And today we're going to talk about all things birth control. And by the way, today is, Sophia?
World Contraception Day.
Woo, we're so happy that we can support this for ourselves and for our children and for our children's children to make sure that they have it accessible and easy to go. So, Dr. Yen, today we're going to be talking about all these burning questions about birth control. So I leave it to you to take over.
Great. I think, the first thing that we should address with respect to birth control is to make sure that everyone knows all of their options. And so it's really important that people understand that there are so many options out there for birth control, and I'm just going to list them from most effective to least effective. So get ready for your quiz, prepare yourself. Most people get this first one wrong. So picture all the methods of birth control out there, most effective to least effective, even throw in the permanent options. And the number one birth control is the implant. And what blows my mind is the implant beats vasectomy. And vasectomy is the gold standard. And if you want to check if your doctor knows their stuff, ask them, what is the most effective birth control, including the permanent methods? And if they don't know that implant's number one, then they're not up to date on the latest and greatest. And next comes, after vasectomy, excuse
Bless
me.
you. No, it's okay. Now I'm curious to see which one it is.
The hormonal IUD. And the hormonal IUD beats tubal ligation, which is the female equivalent to vasectomy. And tubal ligation is not some small thing. They cut, take out an inch, burn. And the fact that people still get pregnant after that is like, whoa. But the fact that the IUD with hormone beats that is like, wow. And so then comes the hormone IUD, then comes tubal ligation, then comes copper IUD. Just know on the copper IUD, a lot of people all over TikTok and Quora and Reddit are like, gosh, I got my copper IUD and now I have a ton of cramps and a ton of bleeding. And I'm like, did your doctor not tell you this before they put it in? I'm pretty sure they counsel you on the side effects and the risks. And the top two side effects are really strong cramps and a lot of blood. And so if you're the kind of person who's like, oh, is that blood dripping down my leg when you get your period? You're a great candidate for the copper IUD. If you're like me and you're like, I feel every single drop of blood that comes down, no copper IUD for you, or know that you will feel every single drop that comes down with the copper IUD. Next comes...
So you don't experience that with the hormonal IUD?
No. So the hormonal IUD, the way it works is it decreases the growth of the lining of the uterus, just like the birth control pill patch ring does, but maybe even more so because it's local and intense. And therefore, when you bleed, instead of a level 10, which is how much you would build the uterus to catch an embryo, you build it to a level 1. And so if you do bleed, there's only this much blood to bleed. Same thing with the birth control pill patch ring. With the copper IUD, it has not that, no hormonal effect at all. And it's just shooting out copper, which kills the egg, which kills the sperm. And then it like inflames the uterus, causes inflammation. So it attacks anything that comes in. Totally different mechanism.
Okay, thank you.
Yeah, great question. And actually, one of the benefits of the implant and the hormonal IUD is that 30% of people that go on that method have no periods whatsoever. And then, as I alluded to before, 70% have lighter periods because it doesn't build that lining up full to catch an embryo because, like, oh, you're trying not to get pregnant. So it just has a little bit of lining on there. So back to the list of birth control methods. Next would come the shot, which is every 12 weeks, and then the ring, the patch, the pill. And the ring, the patch, the pill in that order, because the ring you have 12 times a year, you could mess up. You change it once a month. Or the patch, you have 52 times you could mess up because you change it every week. And then the pill, you have 365 times a year that you can mess up because you got to take that. every single day. And then comes condoms, spermicide. Phexxi comes above spermicide a little bit, and natural fertility awareness methods.
So the most common birth control is then?
The most commonly used form of birth control in the United States, outside of condoms, because condoms are also used to prevent sexually transmitted infections, and condoms are over the counter, and both genders buy condoms, is the birth control pill. Though, if you were to go to other European countries, they have a much higher use of what's called LARC, long acting reversible contraceptives, which is the implant, the IUDs, and the shot.
Got it. Got it. So, with all those options, why would you recommend, or why do you suppose some of us use the pill or the patch instead of, getting an implant?
Great question. So, with the birth control pills, there are 40 different pills, 8 different progesterones with different levels and different levels of estrogen. Whereas with the implant, there's just one. And if you don't like the side effect of that one, then it is what it is. And one of the side effects of that implant is weird bleeding. And some of it goes away, some of it continues. First line treatment for weird bleeding on the implant or the IUD or the depot shot is ibuprofen, 600 to 800 milligrams 3 times a day with food. And that will decrease the amount of blood by 30%. So sometimes that's enough to stop that weird, wacky bleeding. Assuming you don't have any kidney problems, assuming that you're not allergic to ibuprofen. And again, that's a way to quiz your doctor if they know their stuff. First line treatment for weird bleeding on a progesterone only method is that. Then there's also doxycycline, 100 milligrams twice a day for 7 to 10 days. It's an art, not a science. For some reason, it's not. It's also treatment for for chlamydia, but it's not treating chlamydia. It decreases inflammation and therefore decreases this weird spotting. So that's another thing you can try. We had a patient that tried everything, and then we did doxycycline for a week and solved all her problems.
So you keep on mentioning, you can quiz your doctor, and that's because, doctors have specialties, and Pandia Health is a specialist in birth control and hormonal health. And so while your doctor may be very good at, your general practice, when it comes to understanding, the birth control options, Dr. Yen, you've really built up that expertise. Can you tell us a little bit about that specialty and how it differs?
Yeah. So, most doctors do everything, or at least not just one thing. And all that I've done for the past 8 years is birth control. And so, for example, I wrote 3,000 birth control prescriptions over a 2-year time period. Most physicians will write 5 a week, maybe 25 a week max, but not like 50 to 100 a day. And with that, as a woman of color, and as a physician, I couldn't just sit there and watch women get weird side effects and do nothing. Coming from my academic background of MIT, UCSF, Berkeley, and then Stanford, I was seeing that people of color, and speaking to my fellow physicians, were like, oh yeah, what we're teaching in medical school, not good for people of Asian, Black, or Latina descent. It works great if you're a Caucasian female that wants to bleed every month. But for us, we need to change things up a little. And I was like, oh yeah, I had to go through 3 different birth control pills until I found one that worked. And only because I was highly motivated, because I couldn't get pregnant during med school, residency, fellowship. I was like, I have to find something that works. Did I stick through it? Right?
Yeah, you have to, because, some of us just, as you say, just suck it up, and we just put up with all these so-called symptoms that we think is normal with birth control, which is really abnormal. And if you're dealing with a specialist such as Pandia Health, then you have the luxury of this type of specialty care. So love it. Love it. So now, Dr. Yen, so what happens when I've been taking, let's say I'm on the pill or the patch, is there a recommended time when I should take a break from the pill?
So actually, as part of my hashtag periods optional talk, and if you go to pandiahealth.com/periods optional at the bottom, I go over that it's actually natural to have fewer periods than what we're currently having. And when you're on the birth control pill patch ring, you're telling your body that you're pregnant. And so oftentimes, well, you're not popping out an egg every month. And you can also skip that last week to make #periods optional. But bottom line, we are currently bleeding 350 to 400 times in our lifetime. And what would be normal would be 100 times. So we're bleeding for 2 to 3 other women that we don't need to be bleeding for. And that in our natural state, if you go study the Dogon tribe in Mali, Africa, which Dr. Beverly Strassman does, women are incessantly pregnant or breastfeeding. So they have 8 to 9 children. They're breastfeeding for 12 to 18 months. And so how many periods do you have when you're pregnant? Zero. How many periods do you have when you're breastfeeding every 2 to 3 hours? Zero. And so there is really no need to come off of the birth control pill, patch, ring, IUD, implant, or shot until you want to get pregnant. If you want to get pregnant, yes, come off.
Well, I love the story that you shared that. How long were you on birth control?
I was on birth control from 15.
Well, you still are, but yeah.
35, so 20 years.
20 years. And then
after
the funny part is
kids,
when you decided to stop birth control and then all of a sudden you got your period, you're like, oh my gosh.
Yes, my me that we did not have to bleed every month is I'd been on birth control. And as I alluded to, with birth control, your periods are much lighter than if you were not on birth control. So if you're normally 7 days, it goes down to 5. If you're normally 3 pads, it goes down to 2 or 1, because you're not trying to grow that lining to catch an embryo. And when I came off to get pregnant, I was going to like game it so you can get a girl or boy. You can ask me in the comments if you guys need to do that. But after 2 normal periods, it was so much blood that I was like, oh, I don't care. Just impregnate me now. And then I need to pop out a baby and I don't want to bleed anymore.
Yeah. Oh my gosh. I guess that's why there's this like misnomer around where people are like, oh, you know, as soon as I got a birth control took my system out of whack because now I'm having all this. It's just that your system was always, your body was always that way. It's just that birth control helped you, you know, hide that, put that aside.
Yes. So one big myth out there is that people ask, does birth control make me sterile? And my joke is, yeah, that's why you're taking it. But I think the real question is, does it make me sterile when I come off of it? And so I want you to understand that if we have 100 women over here, they're not on birth control. 100 women over here, we put them on the birth control pill patch ring. We wait 10, 20 years, and then we come off the birth control and we're like, both y'all, try to get pregnant. 10% of this group will have a hard time getting pregnant. And 10% of this group will have a hard time getting pregnant. So there's no difference between the groups, but they didn't try before, they didn't know, and now they're trying, and now 10% of each group is having a hard time. And it's because not the birth control, but because polycystic ovarian syndrome affects 1 in 10 of us who are born with uteruses. We will develop it over time. And the symptoms are irregular periods, acne, or hairiness, and cysts on your ovaries if you were doing an ultrasound, but cysts are not necessary for the polycystic ovarian syndrome. But those people don't pop out eggs every month. And if you don't pop an egg, that makes it kind of hard to get pregnant. And then on the flip side, to show even more that birth control doesn't have long-term infertility consequences, I was giving a talk to a bunch of infertility specialists in Taiwan about the birth control pill and what I knew about the differences and the different, 8 different progesterones, 40 different formulations. And I was like, why am I giving a talk to fertility specialists about birth control pills? And they're like, actually, we use birth control pills to normalize the hormones of PCOS people because their hormones are like this. And then you normalize them. And then when you come off birth control, that is the most fertile that person's going to be. And so, bam, you come off, that is the time to get pregnant. Because often PCOS women hear, oh, you're going to have a hard time getting pregnant. And so they're like, oh, okay, I'm going to come off the birth control pill and prepare and wait a couple months and nutrient and other stuff before. No. As soon as you come off, that is the most fertile you're going to be for PCOS patients.
Yes, but also for infertility patients, I mean, the doctors will also put the patients to regulate on birth control as well, which I found very interesting as well. Yeah, yeah. So many things that we need to know. But what are some of the other comments that you hear? Like we hear from our patients, like should I stop taking my birth control? Should I take a break? Is there a certain birth control that will make me gain more weight?
Yes. So again, looking at the research, if you have 100 women on the pill, 100 women not on the pill, the women on the pill on average weigh a pound less than the women not on the pill, because the women not on the pill, you go through your cycles and you bloat up, you bloat down, you bloat up, and you bloat down. So on average, you weigh a pound more than these people that are just flat and then period, and then flat and then period. Whereas you're
Mhm.
like this kind of situation
Mhm.
over here. Certainly, as I mentioned before, there's 8 different progesterones. And if you personally notice when you go on a progesterone, it gives you the munchies and you gain weight, then note that progesterone, note that dose, and be to your doctor. This dose of progesterone makes me gain weight. What can we do about it? And if your doctor knows their stuff, then they'll know these are the progesterones that are less likely to
Mhm.
give a woman the munchies, and these are the better ones perhaps to prescribe. The negative is everything has its risks and benefits. The negative on those is that oftentimes you need to be able to drink 8 glasses of water a day, because if you can't, then you might end up with a headache. And so I had
Mm.
a friend, she got her birth control pill over the counter in China, and she just copied her other friend. So copying your other friend is not the way to go. You want to ask, what did your mom, your auntie, your sister, people that are genetically close to you, what did they do well on? Because that's
Mhm.
most likely what you're going to do well on. But she just took the one her friend, and then she had a headache. And I was like, oh, you're on that one. Are you drinking 8 glasses of water a day? And she's like,
Mhm.
no. And I was like,
Mhm.
there's your headache, girlfriend. Either
Yeah.
drink the 8 glasses or change to a different birth control
Well, that's
pill.
the key about having specialists, right? Because the other thing too is that we hear this a lot from our patients, but I've always been on this pill. But as you get older, your body changes, and good doctors know for long-term care that their medication should change as well for birth control, right?
As you get older, we absolutely recommend less estrogen to decrease your risk of blood clots. But until you're 30, we recommend 30 micrograms of estrogen. And so often a young person will go to a doctor's office and be like, I want the lowest dose estrogen because I don't want any hormones in my body. And the doctor's like, okay. And they'll write you the lowest dose estrogen, but they aren't an adolescent medicine specialist, which I am,
Mhm.
and know that Stanford Adolescent Medicine, Stanford Pediatric Gynecology, Stanford Pediatric Endocrinology all recommend 30 micrograms of estrogen in your birth control pill until you're 30 years old to protect your bone. Because otherwise, when you're 50, 60, you fall down those stairs, you break your wrist, you break your hip, and they won't tie it to the fact that you've been on very low dose estrogen for all of these years when you
Mhm.
should have been on at least 30 micrograms until 30 years old.
Right. And that brings me to another point. It's like it's great that you're looking at, what your friends are taking and what your family, maybe what your mom or your auntie took. But know that our doctors are specialists. And although that medication worked well for them, it may not be for you. And that's what we specialize in, tailoring the best birth control for uniquely you and what you're trying to accomplish. So thank you for bringing up that point. That's so critical. Um, because you do hear about many women breaking their hips when they get older, and so we're just protecting, our patients' health for the long term. What about when we all talk about, that these hormones? I don't want anything fake in my body, and I want something plant-based. I mean, what is? How did that come about? Why are people so concerned about it?
I think that, there are people that are concerned about synthetic estrogens and synthetic progesterones. And so it's
Hmm.
important to understand that for birth control, all of it's pretty much synthetic. There is one that's more bioidentical, I believe, but it's ridiculously expensive. So a
Hmm.
normal birth control pack is like $17. That one's like 170 or maybe even more than that. So you could get a
Well, what's
year's
the issue
supply.
with the synthetic hormone, though? I
The
mean,
synthetic hormone is just people like bioidentical. And so
mm,
when it comes to menopause hormones, they are
mhm,
bioidentical. But when we're
mhm,
talking about birth control, pill, patch, ring, IUD, implant, shot, those are all synthetic, except for one birth control pill that's ridiculously expensive. So
mhm,
it's a,
mhm,
a cost benefit.
mhm,
Um, And just so everyone knows, estrogen has not been linked to increased breast cancer, specifically for menopause therapy or menopause hormonal therapy or hormonal replacement therapy, depending who you want to talk to. There's a book, and I'm looking at it on my desk. Hold on.
Where is it?
Estrogen Matters. I don't get paid by this, but basically it goes over the World Health initiative, where they researched women on estrogen, and actually the women who didn't have uteruses, just got estrogen only, their risk of breast cancer went down by 30%.
Amazing.
So it's not the estrogen causing breast cancer. It was the women who were on estrogen and progesterone that had a slight increased risk of breast cancer. So now we're thinking it's the synthetic progesterone that increases that risk.
Yeah, that's what I love about Pandia and also you, Dr. Yen, is that you're all about information, because information is power, right? And so this way you could take these myths, you could test them out, and then know that you are, on the good medication that our doctors recommend. So I'm going to say, just a little question, because we did get this question. What happens when I am done? I've decided to have some kids and I'm around 40-ish, and I'm noticing certain things that are happening. But yet when I talked to my doctor, they said that I still have to use birth control. And I thought maybe because of the hot flashes that maybe I would be on some type of medication. Can you explain that to me, birth control and perimenopause?
Yes. So a lot of people get upset when they come to our menopause, perimenopause platform, not us, but to any provider. And they're like, I heard that I have, perimenopause symptoms and I need to get hormonal treatment. Well, realize that birth control is hormonal treatment. Birth control has estrogen and progesterone in it. And as long as you are at risk of pregnancy, then it's nice to use birth control because it covers that risk of pregnancy. And the other thing is it takes over your system and smooths out the hormones versus up and down, up and down. And if I were to show you a graph, and there's a couple of different graphs of your estrogen level, which is around 40 before you go into menopause, perimenopause. And perimenopause is like 6 to 7 years before menopause. Menopause is technically the day of your last menstrual period. And then you don't know that until 12 months after. But anyway, perimenopause, this part, your estrogen is like, and so I could add estrogen on there, but then what if it's up here and I add more? That's not going to help the situation. What's going to help the situation is to smooth it out. And so most physicians prefer to smooth it out, this weirdness, with a birth control pill, not for necessarily for birth control, but as hormonal therapy to take over the system so you don't have the hot flashes, the night sweats that you're getting.
Okay, great. Thank you. That's a frequently asked question. And then the other one, as you were talking about that, is progesterone only pills. And some patients, maybe, prescribe that because they either have migraines or some other medical conditions. Can you talk about that and why some are not happy? Because we have had patients who are like, I don't want a progesterone only pill. But I think a lot of the people out there do not understand that the wrong medication could kill you.
That's exactly it. So in general, most physicians prefer the estrogen progesterone pill because the progesterone only pills have this side effect of random bleeding. And each person is different. Some people, their periods go away and they're like, yeah. The other people is just random. And they're like, oh no. And then other people continue. So I think it's like 30, 30, 30. 30% go away. 30% will continue every single month. And like, fine, that's the way it is. But a lot of people come to us for #periods optional. And then we're like, oh, you are a smoker or vapor and you're 35. So if you're a smoker and vapor and 35, no estrogen containing stuff for you because you have a greater risk of stroke or pulmonary embolism, things that you don't want, things that we don't want, and that legally we cannot prescribe you with, or we put ourselves at liability. And being a telemedicine company, if one of us loses our license, it shuts the whole thing down.
Well, it's a patient's life too, right?
Yes. We don't want your life or your morbidity, as we like to say. You don't necessarily die, but now you're stroked, or you have a pulmonary embolism. That's near death experience for some. So that's why we would recommend a progesterone only pill. Migraines are fine, but migraines with aura. So aura is like you taste something funny or you see something before your migraine's happening, or if you have any visual or neurological symptoms with your migraines, on the estrogen. Know that there are two different types of progesterone only pill. The standard progesterone only pill has this whack bleeding and is very unforgiving. You have to take it at the exact same time every day. And if you take it 3 hours late, and my joke is you go see, this is menopause brain. What is it? Oppenheimer.
Yes.
You see Oppenheimer and you forget 3 hours, then you are literally screwed. If you've had heterosexual relations within the past 5 days and that sperm is still around and you are late 3 hours taking a progesterone only pill, you could get pregnant. So you may want to throw some emergency contraception at that. And you have to wait 2 days while that hormone level gets up high enough to protect you from future pregnancies. You certainly could use a condom during that time. But if you had sex in the past 5 days, that's not a good thing. So that's one type of progesterone only pill. There's a new one.
Great tip.
There's a new progesterone only pill. It's called Slind, and drospirenone is its generic name. It is very good at decreasing acne, decreasing bloating, and it might even be okay with #periods optional. The problem with that one is it's generally very expensive. It's probably $170 versus your normal $17. We can sometimes argue with your insurance to get it. Sometimes it works, sometimes it doesn't, but we'll charge you for our doctor's time and no guarantees. It's all on your insurance side, whether they pass it or not.
Right. They do have a copay card, a savings card that does make it affordable. But yes, Dr. Yen is a fan of those because it can help you perhaps skip your period. And, if you have acne, wow, even better. All right. I know we're getting close to short of time, and a lot of our patients have gone to start college. So just really fast, as you're talking to your, make-believe daughter, what would you say to her about birth control and things to keep in mind?
Well, I think anyone born with a uterus that still has a uterus and a vagina is at risk until 52, 53 of pregnancy. And God forbid sexual assault. Know that 1 in 4 college people born with a uterus is the stat will be sexually assaulted. And so if you were on birth control at the time, the likelihood of being impregnated by your sexual assaultant would be lower, but at the very least have some emergency contraception around. And so at Pandia Health at checkout, we're always like, you want some emergency contraception with that? And know that there are 4 different types of emergency contraception. If it were me, my daughter, my friend's daughter, you, anybody listening to this today that were sexually assaulted and at risk of pregnancy, I would advise you to run to the ER and tell them to throw up a copper IUD, which has a 99.99999% chance of preventing unplanned pregnancy within 5 days of sexual assault or contraceptive oopsie. Or you could also throw up a hormonal IUD. But the second most effective option is a prescription emergency contraception. And because you're using Pandia Health already, or you have a provider and can ask them to prescribe it for you, at Pandia Health, we always write, please give the patient the one with the farthest expiration date. This is for future use, and hopefully the pharmacy can give you one that's like 2 years from now. And then you can just have it sitting in the corner in case the condom pops, in case your friend's sexually assaulted you. Be like, here, please take this on your way to the ER and to get things worked up. And so as I like to tell patients, if the condom pops at 3 a.m., I want that medicine in the uterine-bearing person's body by 3:10. No cuddling, no huddling, no waiting till the morning after. 3 a.m. pop, medicine in the mouth at 3:10. But if you don't have it, then you have to call your doctor, hunt it down, run to the pharmacy. Do you have money? Do you have transportation?
Oh my God, all that stress. Yes.
No. And meanwhile, the clock's ticking. Every minute you're waiting, you could be getting pregnant. And it's just not cool. It's stress you don't need. Deal with that when you're not under that situation. And then also as a tiger Asian mom, my tip to you, are you going to do better on your MCAT, GMAT, GRE, finals, competition for whatever sport, speech and debate, pitch for your startup, bleeding or not bleeding? Because I've given my 2 daughters the option to make #periods optional. And we give that option to all of our patients. So you could at least, if you're on the pill patch ring, move your period away from spring break or from finals or from your LSAT or your GRE or your MCAT or your finals,
Mhm.
blah, blah. Or if you play a sport for a whole season, you don't have to bleed for 3 months.
Right, right. Wonderful. Thank you. And then I guess just a reminder that birth control is that birth control. It is not to prevent STIs, or is it STIs or STIs or
STI.
STDs? Yeah, STIs, right? So no matter what, if you're active, wear a condom. If that person cares for you, they will wear a condom. Not know that. All right. So then, Dr. Yen, you wanted to mention a few things. One of them is your TEDx talk. That
Yeah.
is, yeah. So can you talk a little bit about that, and then where we could find it? I'll also put it on the notes.
Yes, I did drop it in the comments right now.
Mm-hmm.
pandiahealth.com/periods optional. And so, as you alluded to earlier, I realized trying to get pregnant with my first child, one, it was a lot of blood. And two, why are we doing this every month from age 12 until 26 on average in the United States for the first baby, or for those of us who took a while or had other obligations, 35, and then you pop out 2 kids, and then why are you bleeding from age 38 to 52? That's a lot of years on both sides. And every time we build up that lining, it can mutate and turn into endometrial/uterine cancer.
Mm-hmm.
Every time we pop out an egg, and we don't know if it's the popping or the healing, we know it has something to do with the tubes. So if you ever get your eggs out, take your tubes out too. You risk ovarian cancer. And another quiz to see if your provider's up to date, which most providers should know, but I don't know if everyone's trained the same as those of us who went to UCSF. That what can I do to decrease my risk of ovarian cancer? If you can go on before you go menopausal for 5 years, the birth control pill, patch, or ring, you decrease your risk of ovarian cancer by 50%. There is no other way to
Amazing.
prevent ovarian cancer currently, to our knowledge. And ovarian cancer is very difficult to detect. And usually by the time you detect it, you are stage 4, and that is close to death and
Yeah.
not very good prospect. So everybody born with ovaries should consider going on the pill patch ring, in my opinion, for 5 years to decrease your risk of ovarian cancer. And then if they're going to go in there anyway and you're done with your children, they could take out your ovaries if you're postmenopausal. But if you're premenopausal, don't want to take them out because you like the hormones. They're good for your brain, your blood, and other parts of your body as well.
Thank you
So
for that.
yeah, check
Yeah.
out my
So
TEDx talk and share with everyone.
share, yeah. And just as a reminder, thank you so much for joining us with Pandia Health. As you all know, we provide online doctor consultations for birth control, acne, and menopause. For birth control, one of the goals of Dr. Yan, who's our founder, was to make it affordable and accessible. So for those, that don't have insurance or have limited funds, like I was when I was in college, it's only $30 to see a specialist for birth control consultation. And again, the goal is to make birth control accessible. That's our mission, and affordable. So, you can start out with birth control pills starting out as low as $15. So thank you so much for taking the time to hang out with us and learn a little bit more about birth control. If you believe in reproductive rights, don't forget to vote. Have a good one. Thank you, Dr. Yen.
Thank you, Susanna.
Bye.